Good morning, everyone. Good afternoon. Thank you for joining us today. My name is Marie-Claude Allard. I'm the communication lead for CANUE. I would like to start by acknowledging that the Université de Montréal, where I work, is located on non-treaty Aboriginal territory. This land has long served as a site of meeting and exchange among Indigenous peoples. I wish to pay tribute to those who, since time immemorial, have been its traditional custodians. Before we get started, I would like to remind you to turn off your camera and stay on mute during the webinar. If you have questions during the presentations, please put them in the chat. Speakers will answer them as we go along. We will also save time at the end for Q&A. Also, this presentation will be recorded and sent to all registered participants after the webinar. This is the third and last introductory webinar in a project funded by the Federal Canadian Municipalities Local Leadership for Climate Adaptation program. This initiative, which is led by CANUE and the Canadian Health Association for Sustainability and Equity, is focused on providing resources to local stakeholders to help them integrate health and health equity considerations into local climate adaptation plans. So from the registration, we can see that you are joining us from all around Canada. It's my pleasure to introduce you to our first speaker, Rebecca Snyder. Rebecca is a climate change and health specialist in BC's Ministry of Health Climate Resilience Unit. Prior to her position with the BC government, Rebecca worked at Health Canada's Climate Change and Health Office, where she was a co-editor and lead author of the National Climate Change and Health Assessment that was published in 2022. Rebecca is also a PhD candidate in the School of Public Health at the University of Alberta, where her research explores and assesses the climate change and health literacy of climate change professionals across Canada. And to you, Rebecca.
So hi, everyone. I'm Rebecca. I'm really happy to be here today with you all. So I'm going to kind of set the stage for our discussion and provide a brief overview of the health impacts of flooding events and how health inequities and determinants of health influence how individuals and communities may experience these events differently. And then I'll hand it over to my colleague, Emily, and Danny following. I'm so grateful to be calling in today from the land of the Lekwungen people, known today as the Esquimalt and Songhees First Nations and colonially known as Victoria, BC. And to start, I just wanted to highlight a report that my team published recently called Climate Change and Health in British Columbia: From Risk to Resilience. This report collects and synthesizes existing evidence and information on the health-related impacts of climate-related hazards in BC. And it includes a chapter on flooding. So much of the information I'm sharing today comes from this report. And although it's focused on BC, the health risks related to flooding are generally the same across the country, so still relevant for your communities. So as you likely know, climate change is increasing the risks of flooding across the country. A warming atmosphere can hold more moisture and more energy for storms, intensifying extreme weather events like heavy rainfall, which will increase urban flood risks. Coastal flooding is also expected to increase in many areas across Canada due to local sea level rise and rising temperatures. A reduction in snow cover and earlier seasonal snowmelt can also lead to riverine flooding. And an increase in flooding is predicted to have significant consequences on health, as well as the environment and the economy. And we're already seeing this play out across the country. So one example in my home province that you might be familiar with is the atmospheric river and flooding events in 2021 that brought record amounts of rain on southwestern BC. In many areas, monthly precipitation totals were more than 200% above average. And at the same time, warmer temperatures accelerated snowmelt and led to record stream flows. So significant flooding occurred. This also led to landslides in part of the province, and that resulted in multiple highways that were blocked and damaged. And this meant that many communities were completely cut off from the rest of the province, and the province itself was under a state of emergency for more than 2 months. Evidence and research suggests that this atmospheric river event was made more likely because of human-caused climate change. So there's a number of impacts on health from flooding events, health risks from the floodwaters themselves, as well as health risks caused by events triggered by flooding. So this could be things like property damage, water contamination, and landslide and mudslides. Some health events occur during the flood, while others can occur after the event. So some direct impacts on health include injuries or drowning. Injuries commonly happen during or after floods when people return to clean and repair their homes. For example, flooded buildings can have damaged wires or electrical appliances that could electrocute people. Flooding can also cause the spread of diseases through water contamination and sewage backup. So, for example, heavy rain can overwhelm sewage systems and water treatment infrastructure, causing overflow, contamination to drinking water, or backup into household plumbing. Flood waters can also mix with pollutants in the environment, like agricultural wastes or chemicals, and that can cause contamination to drinking water. Diseases can also be spread through food contamination. So, for example, power outages can be caused by flooding, and that can increase the risk of food spoilage and foodborne illness if that food can't be maintained at safe temperatures. And food can also be contaminated by floodwaters. So, for example, agricultural crops inundated with floodwaters that have transferred sewage or chemicals onto the soil. And flooding can also increase the risk of some vector-borne diseases. For example, sitting water can increase the number of mosquitoes, which can carry diseases like West Nile. Indoor air quality can also be compromised because floodwaters can cause bacteria and mold growth in homes, leading to allergic reactions and breathing problems. And things like carbon monoxide poisoning is also a concern, again, because floodwaters can cause power outages. During those outages, indoor ventilation systems aren't working, and that can increase the risk of carbon monoxide poisoning if you use gas-powered generators or gas-powered cooking appliances indoors. Evidence also suggests that repeated exposure to extreme events like flooding is associated with decreased mental well-being in many ways. So these mental health effects include loss of sense of identity and place, heightened anxiety, and risk of depression, along with post-traumatic stress disorder and other adverse outcomes. And flooding also impacts our health system by directly disrupting the delivery of health care due to power outages and damage to water supply and transportation networks. Loss and damage to medical equipment, healthcare facilities, and infrastructure can lead to long-term disruptions in service delivery, and in some cases result in the evacuation of patients. So, for example, in the 2021 atmospheric river and flooding events, we saw supply chain disruptions that resulted in shortages of food and baby formula, hospital supplies, and medicine in many areas of the province, and that created really critical challenges for the residents stranded in those communities. And this really just demonstrates how climate change is such a wicked problem because it increases the demand on our health system while simultaneously straining it and decreasing its ability to respond. And while everyone is vulnerable to climate change, some populations and communities face disproportionate risks and impacts. And this is due to complex relationships between climate change, health, determinants of health, and health inequities. The framework on the slide here was developed for the National Climate Change and Health Assessment published in 2022 by Health Canada. And I'll just briefly provide an overview of this relationship. So at the top of the framework, you'll see the drivers of inequity. These are systemic and structural drivers like racism and historic and ongoing colonization, and that gives rise to unequal distribution of power and resources. And this shapes and influences the status of determinants of health, either in a positive or a negative way, and that can give rise to health inequities. And for those of you on the call who aren't familiar with determinants of health, these are conditions and factors that affect a person's health. So things like income, education, employment, and working and living conditions. The determinants of health and health inequities can increase or decrease an individual's exposure or sensitivity to climate-related hazards, and they can also create barriers that limit adaptive capacity. And those three concepts collectively make up climate change vulnerability, exposure, sensitivity, and adaptive capacity. So for example, where you live has implications for flood exposure. Those that live in floodplains are at higher risk of being exposed to floods. Your income level also has implications, for example, on your ability to cope with and adapt to flooding. So those who don't have flood insurance, the losses to property and belongings from those floods can't be recovered, and that compounds economic disadvantage and further limits individual adaptive capacity for future climate hazards. You'll see the green boxes on the right here of the slide. Those are climate actions, so mitigation and adaptation actions. And those measures themselves can interact and impact determinants of health and influence climate change vulnerability, again, in a positive or negative way. For example, green infrastructure. So things like green spaces and rain gardens, they're a promising adaptation strategy for reducing flood risk. And they also offer other health benefits like reducing the risks associated with urban heat island effect. But not everyone has the same access to a green space. Historically, in large cities, green spaces are more common in higher income white neighborhoods, and that affects who's able to use and benefit from them. And so because of this, a municipality may consider enhancing green spaces in areas that are lacking them, but this can have unintended consequences without careful planning. So for example, new green spaces could perpetuate gentrification and increase property values in the neighborhood, and that could lead to displacement of low-income residents or small businesses. So to address these concerns, adaptation plans may involve instituting rent control policies and other strategies to maintain housing affordability when creating those green spaces. So ultimately, improving determinants of health and redressing health inequities can reduce vulnerability to the health impacts of climate change. And so as you work on climate change strategies and mitigation and adaptation actions at the municipal level, you might consider, how does my work impact determinants of health? And are there opportunities to leverage climate actions to improve health equity and determinants of health? So we often get asked by decision makers who's most impacted by climate-related hazards. And typically that's because resources need to be prioritized or targeted in certain areas. And as you've just seen in the last slide, there's not always a straightforward answer. There's a lot of intersecting factors that influence vulnerability to climate change. The population groups here on the slide are frequently disproportionately impacted by flooding events, but it is important to keep in mind that these populations are not homogeneous. There's a lot of variability within them, and they're also not discrete. So an individual could fall into multiple groups listed here. Most importantly, all of these groups demonstrate factors of climate resilience in different ways. So I just want to avoid the problematic narrative of naming these as vulnerable populations. So with that said, in general, research indicates that many of these groups do face disproportionate impacts by flooding events because they have lower capacity to personally respond to a flood because of financial insecurity. Some of these groups are more exposed to flood risks, such as those living in floodplains and rural and remote communities. Farmers, for example, face heightened impacts from flooding events given their increased risk of exposure and the reliance on land for their livelihood. Migrant farmers, for example, may also face language barriers to understanding public health and emergency preparedness messaging and have limited social supports and connections in their host community. And people with existing health conditions or complex care needs face mobility challenges during evacuations, for example, or evacuation shelters may not be equipped to address their unique needs. So again, for those of you who are outside of public health, who are working on municipal climate action, you might consider, as you design and implement your climate actions, who is this impacting? And are those groups that are disproportionately impacted by this climate hazard going to benefit from this adaptation or mitigation measure? How can I develop actions where the benefits are maximized and those potential adverse impacts are minimized? And in addition to building your own knowledge and understanding of health equity implications of climate action and using tools and resources like the Healthy Plan City tool, collaborating with health staff is another way to ensure that health equity considerations are reflected in your climate action work. So health staff can play an active role in municipal climate action and really help to bring that health equity perspective. And across Canada, the health system and health authorities are already taking action to protect communities from the health risks of climate change. They're conducting climate change and adaptation vulnerability assessments. So building relationships with health colleagues and identifying those synergies and potential areas of collaboration can really support robust and effective climate action. So I will leave it there and turn it over to the next speaker.
Thank you, Rebecca, for this great presentation. And now let me introduce you to our second speaker. Unfortunately, Craig Brown cannot present today. Emily Peterson will present instead. Emily is the Senior Environmental Health Scientist of the Healthy Environments and Climate Change team at Vancouver Coastal Health. She works in partnership with local and regional governments, academics, and community organizations on a wide range of complex and rapidly evolving environmental health topics, including air quality, climate change, environmental contamination, and healthy community design.
Thanks so much for the opportunity to present. I'm quite excited to be here with this group of individuals. And I just wanted to thank a couple colleagues who helped me put this deck together. So I've got a colleague, Laura Chow, who's a senior planner on our team, and Megan Straight, who's an analyst. And then I also received help from a few other colleagues. So before I get started, I want to acknowledge that the land in which I'm giving this presentation is the traditional and unceded territory of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations. And here at Vancouver Coastal Health, we work with 14 Indigenous communities. So this here is a quick overview of our team. So I sit in Vancouver Coastal Health's Healthy Environment and Climate Change program, and we have 6 staff member on our team, and this includes health scientists, climate change experts, senior planners, medical health officers, and also some fantastic analysts on our team as well. So the work that we do, we focus on climate change adaptation work, so preparing for and responding to both current and future challenges associated with the health impacts of our changing climate, and that's what we're talking about today. We also have a pretty large community planning component where we work with municipalities and other governments on building healthy communities that support positive health outcomes and also reduce exposure to environmental risks. And then there's a few of us who work quite intensely on environmental exposures. And so this is reducing exposure to health harming contaminants through air and water. And we also work on climate change mitigation through some of the co-benefits that we see from health from mitigation actions. So today I'm going to talk a bit about some flood risk mapping that we did about over 5 years ago now at the Health Authority. I'm going to talk about a few examples of government actions to reduce flood risk, and then I'm going to jump into some personal preparedness and community level actions. So to start with flood risk mapping, um, here at Vancouver Coastal Health, we conducted community health and climate change risk maps. We did some analysis, and that was back in 2019. And we looked at across our region, we looked at heat, smoke, ozone, and also flooding. And we took data from 3 different categories, so exposure, sensitivity, and adaptive capacity, and combine this data to create climate vulnerability maps. I would say flooding was probably the most challenging one for us in terms of finding exposure information and data, and as well as determining the adaptive capacity components. But this is an example here of one of the maps for the city of Richmond, but I'll talk a little bit about their diking system and how they have really quite a lot of protective measures to prevent flooding in that community. And these maps are now 5 years old, so there's a lot of new evidence and information that has come out since we developed these maps. Just to quickly provide information about the sensitivity and adaptive capacity data that we use. So for sensitivity, we looked at people, older adults, people with asthma, anxiety, COPD, multiple chronic conditions. And for adaptive capacity, we used a large range of variables, including living alone, population density, and some emergency supplies and 4 or plus people to confine in. So these variables were determined based on a systematic literature review that was done. I guess it was about 6 or 7 years ago now. So I'm sure that there's more updated risk factors at this point. So in terms of government actions to reduce flooding risk, governments can take a very large number of different actions from source and reducing exposure all the way to kind of the receptor side of things and individual actions. So when we're talking about the source actions, governments can take actions to reduce the flood hazard, and that includes wetland restoration, some green infrastructure work. So work to try and really reduce the amount of water coming into a community during a flood event. The next kind of level of action that can be taken is flood protection, and that involves creating, human-made physical barriers like dikes to protect communities from floodwaters. Um, there can be land use decisions that can be made. So talking about ensuring communities are not built in floodplains, creating, restrictions on buildings that are in floodplains, or even, managed retreat or floodproofing. And then we can also we can talk about raising preparedness. So that's early warning systems, evacuation plans, and flood hazard mapping that can be taken, and these local governments can actually can start to increase awareness for individuals that are within floodplain areas. And finally, they can promote, personal preparedness actions, including, emergency response actions, insurance, and relief funds, as well as recovery planning. So this is an example community that we have. This is the city of Richmond that I had shown our risk maps for previously. And they are 1 meter above sea level right now. And they're surrounded by an amazing dike system. So this image here is showing you the dike system, and they've got 49 kilometers of dikes that hold back waters from this community. Um, they have one of the most comprehensive flood protections in the province, and they're handling a 1 in 500 year Fraser River flood event with their diking system. They've also got a large drainage network of pump systems to remove excess water. Um, and they're continually strengthening their flood protection infrastructure as they work on this and recognize that our climate is rapidly changing. Another example, this one comes from Pemberton Valley. It's a smaller community to the north of Vancouver, and this community has a river that runs directly through the community, and they have considerable flood hazard related to that river. So they've created a flood mitigation plan. The community worked quite hard to create this plan, and the plan includes actions to strengthen the existing dike system, building new dikes, um, ring dikes to protect densely populated areas, removing gravel from the river, and other actions that can be taken. And this is the last community that I just wanted to share an example for, which is the District of North Vancouver, which is another community that we cover. And there's some push from the province and partners to start to increase density in the single detached home zoning areas. And this is one of their single detached home zoning areas. And you can see that this is quite a significant flooding event. We had a huge amount of rain that came very quickly, and it's kind of sitting on a mountain slope, this community, and the water just pushed into the community, and a lot of basements got flooded and a lot of homes were impacted. And so as there's consideration of increasing density in these communities, there's some concerns with regards to in-ground basements. They come with incredible development costs. You need pumps to pump out the water, and there's also underground streams all over this community. So there's a lot of work that needs to be done to ensure that the underground streams don't overwhelm the infrastructure. So the city's now working to address this, and they're looking at potential policy opportunities to remove these risks. They're trying to think about ways to move the livable spaces around. Can we have taller buildings? They're thinking about allowing less frontage and allowing the buildings to be closer to the street to increase density. They're talking about permitting larger coach houses. And there's a lot of trade-off with all these options, but they're really thinking about flood risk and flood protection as they're taking these actions and considering the next steps for their community. So I'm just going to jump a little bit into personal preparedness and community level actions now. So in BC, we have a fantastic group called Prepared BC, and they create preparedness guides for emergency events. And one of them is the flood preparedness guide. So this is a community-focused guide that individuals can take, and it's got, you can write in the guide. It's got steps that people can take to assess, the risk of their area. They can talk about what the kinds of things they need to have in their go bag. And then, like as the image I showed here, it also provide guidance on actions you can take in your home to reduce flood risk. So it's a great kind of working guide for the public to be able to work through as they think about flood preparedness for their community. These images here are from our colleagues at the National Collaborating Center for Environmental Health. And this infographic is what I'll call it, is really trying to increase awareness of the risks of flooding. So understanding that when there's been a flood event, there's immediate risks, and there's also risks when you go back into the community. And that's a little bit about what Rebecca was talking about previously. So this includes risks from the air, mold spores, volatile chemicals, gas links, carbon monoxide, but also from the mud and from the flood water, including risks of injury, pathogens, damages to structures. And then of course there's concerns because of course as there's a flood, you get all the stuff from the community is now like in that water. So all the chemical contaminants, including fuels, pesticides, solvents, metals, you name it, is now in that flood water. So, really trying to teach the community about thinking about those risks when a flood event does happen. And my last two slides here, I just wanted to emphasize and really bring home the importance of social connection for climate resilience. So this is not just for flooding, but for climate events in general, including heat and smoke and wildfires. And there was a community that came together during a flood event that they had where there was quite a large flood event that happened in 2022. And this community ended up not having government individuals able to provide support quickly in this community. And there's basically what ended up happening was that the community used social connection to get everyone out safely. And so this event really emphasized the importance of social connection for public health safety, for human health risk, and we also see that of course during heat events when people who have neighbors and other communities who are checking on them regularly, these individuals tend to fare better off during heat events. I just wanted to show two guides that are focused on this and within our region. So we have the Hello Neighbor Collective, which is a fantastic collective within our province that's working on social connection and resiliency across our communities and thinking about how do we design our communities to promote social connection and resiliency. And they have a guide for local governments to think about how we can do that in multi-unit housing. And then there's also a Prepared BC guide specifically for neighborhood preparedness that helps individuals work through social connection and the importance of social connection and resiliency. So that's my whirlwind presentations. Please visit our websites if you'd like to. Here's two websites, but we've got a number, and you can also reach out to us via email. We've got a email contact there.
Thank you, Emily. That was a great presentation. And now our final speaker, Danny Doiron. Dr. Doiron is the managing director of CANUE and an assistant professor at the Université of Montréal, Department of Environmental and Occupational Health.
Thanks, Marie-Claude, and thanks a lot to Emily and Rebecca for their presentation and the extremely valuable resources that they've shared with us today. Um, So in my part of the webinar today, I'll introduce how the Healthy Plan.City tool can support municipalities and other local stakeholders in identifying priority areas for flood adaptation efforts. So on this slide here, you see flood susceptibility maps for Vancouver on the left, Toronto in the middle, and Montreal on the right that we generated through the Healthy Plan.City tool. And the maps illustrate how flood risk varies significantly within urban areas. So not only from city to city, but as you can see, especially in the case of Vancouver here, across neighborhoods within a given city. So what makes Healthy Plan.City especially useful in its ability to overlay is the ability to overlay flood risk data with demographic indicators like income, age, household status, and immigration status. Some of the equity deserving populations that Rebecca mentioned in her presentation. So this helps local decision makers focus on areas where both the physical risk of flooding is high and the vulnerability of populations is also greatest. This then enables decision makers to take a more targeted and equity informed approach to climate adaptation. So for those who weren't at our first two webinars, this is a very brief overview of the Healthy Plan.City tool. So Healthy Plan is a free web-based tool that allows anyone, it's public tools freely available to map demographic and environmental indicators in 129 Canadian municipalities. And within these municipalities, the tool allows users to explore the distribution of different indicators, like in the previous slide, distribution of climate-related indicators such as heat, extreme heat, or flooding, as well as other health relevant indicators such as access to different amenities and air pollution. The tool also allows overlaying demographic indicators to paint a picture of environmental inequity in Canadian cities. And finally, Healthy Plan allows users to compare environmental inequity across similar sized cities and within a city, so between different neighborhoods within a city. And the main aim with this tool is twofold. Firstly, to support data-driven local public health and urban planning decision-making. And secondly, to empower local communities by providing them with data that can facilitate advocacy. So this slide highlights the data that users can map on the tool. So in total, we have 13 different environmental indicators and 13 vulnerable populations or equity deserving groups. And these can be explored in all 129 cities included in Healthy Plan.City. The environmental data is derived from a variety of sources, including large geospatial databases, satellite imagery, and statistical models. While the demographic data are all obtained from the Canadian Census. And finally, all the data in Healthy Plan.City are nationally consistent and are indexed to each city block in the tool. So again, if you want more detail on the tool, please watch the first webinar in this series, which was hosted in April and which is available on the CANUE website in the Climate and Cities section of our website. So here's a bit of additional information on the flood susceptibility data that we use in Healthy Plans. So to estimate flood susceptibility in the tool, we use a data set that was developed by Natural Resources Canada and processed it in collaboration with Partners for Action, which is a group that focuses on flood risk and equity at the University of Waterloo. The NRCan Flood Susceptibility Index was derived using machine learning algorithms that predict how likely an area is to experience flooding based on patterns of observed historical floods since the 1970s. And the data has a 30-meter spatial resolution, which allows for block-by-block analyses in Canadian cities. Let's now turn to two recent examples that illustrate the growing toll of climate-driven flooding in Canadian cities. So this is in addition to the atmospheric river example that Rebecca mentioned in her presentation. So in Toronto in July of 2024, the remnants of Hurricane Beryl brought over 120 millimeters of rain in just 12 hours. And this resulted in major flash flooding across the city, with power outages affecting more than 123,000 people and nearly $1 billion in insured damages. And just a few weeks later in Montreal, we experienced extreme flooding following the remnants of Hurricane Debby. And this storm caused widespread damage as well, with $2.5 billion in insured losses, making it Quebec's most expensive flood event on record. Over 260 homes were flooded, particularly in low-lying neighborhoods in and around the island of Montreal. And these events are not just about intense rainfall, they're also about who is most exposed and affected. So a recent study shown on the right here, titled Exploring Spatial Heterogeneity and Environmental Injustices in Exposure to Flood Hazards, found that exposure to flood risk is most significant in Canadian neighborhoods that predominantly comprise certain vulnerable groups. These findings then highlight the importance of understanding who is most exposed to flood risk and ensuring that adaptation efforts take these social and demographic factors into account when planning future events. So on this slide, I'll be showing the distribution of flood susceptibility for the City of Toronto using the healthyplan.city tool. So to do so, we first start by selecting Toronto under the first drop-down menu, and then we select flood susceptibility under built environment menu. This map gives us a high-level view of areas within Toronto that are more prone to flooding, helping identify locations where adaptation and risk mitigation measures may be most needed. The scale here is from 0 to 100, with low values in blue and high values or flood-prone areas in red. As shown here, clicking on any location provides a flood susceptibility index value for the corresponding city block. And as you can see, higher risk zones are found in low-lying areas of Toronto and near valleys such as the Don Valley area in the middle of the screen here. Healthyplan.city also allows users to explore the distribution of demographic characteristics within each city. So these then allow us to look at key populations that might be more vulnerable to the impacts of flooding or extreme heat. So to view this information, we select none under built environment, and then on the third drop-down menu, we can choose a demographic or vulnerable population indicators. In this example, I'm displaying the percentage of low-income individuals, a group that may face greater challenges in preparing for and recovering from flood events. And as with the flood susceptibility data, these demographic values are available at the city block level. And as I showed here, clicking on a block provides a percentage of low-income individuals in that location. So, oh, sorry. So I've shown in our previous webinar, which again is recorded and available on our website, Healthy Plan allows users to identify areas where relatively higher proportion of vulnerable populations or equity deserving individuals live in areas with less favorable environmental conditions. And these areas are displayed in the tool in what we call equity priority maps. So here I'm showing equity priority maps that are generated using the two indicators that I just presented. So with low-income individuals layer selected, I selected flood susceptibility layer, which generated the equity priority map based on this combination. The city blocks shown in yellow and red here represent areas with both higher flood risk and higher proportion of low-income residents. And this map gives us a block-by-block view of where these two factors intersect, highlighting the neighborhoods that may require most attention from an equity-informed planning perspective. The equity by the numbers window that you see on the top right here provides amongst other information, the percentage and the absolute values, the absolute numbers rather of individuals, low-income individuals in Toronto living in flood-prone areas. So before we move to the Q&A, I'd like to take a pause for a few minutes so that you can try out the healthyplan.city tool yourself. As we've discussed both in this presentation and Emily and Rebecca's presentation, flooding is a serious and growing risk in many Canadian communities. So understanding where that risk is concentrated is important, is an important first step towards planning effective local responses. So let's take a moment now to explore this in your community. Please open a tab in your web browser and go to healthyplan.city. I believe Marie-Claude either already did or will drop a link for the website. So you can click on that link. And then once you're on the website, select your municipality in the first drop-down menu. If your municipality is not listed, try selecting the closest largest urban center because the tool includes cities with population of 30,000 or more. Next, under built environment menu, choose flood susceptibility. And then in the vulnerable population drop-down menu, select none. So we'll move on to the second interactive activity, this time with focus on the city of Hamilton. So in this activity, we'll shift from looking at where flood risk is highest to understanding who is most affected. So the goal here is to explore how flood susceptibility intersects with social vulnerability using the healthyplan.city tool. So for this activity, you can select Hamilton from the municipality dropdown or the city dropdown menu. And then under built environment, select flood susceptibility. And finally, try selecting different vulnerable populations under a third dropdown and see how the values in the equity by the numbers window vary from one population to the next. As I mentioned earlier, the equity by the numbers section shows both the percentage and the absolute number of individuals from various population groups who are living in areas identified as most flood prone.
Thank you, Danny, for this great presentation once again. And I want to thank you for answering these questions. This information will help us better tailor upcoming webinars and adapt the Healthy Plan tool to user needs. Now, based on what was entered in the chat, Kim Perrotta is the Executive Director at Chase, will direct a few questions to our speakers.
Hi, thanks, Marie-Claude. So there's one question here for Emily from Jeff Brook. In thinking about how cities adapt, nature-based solutions are often brought up as part of the approach. Do you have insight or an example that you can use where a nature-based solution approach has feasible and effective, and given major infrastructure projects are expensive and take time, what has been done or considered in your region to implement nature-based approaches? So I know, Emily, that might be a little beyond your area of expertise, but maybe if you have an example that comes to mind.
Sure, yeah. I will say, I'm not an expert on this in our region, but I can tell you that a number of our municipal partners have been implementing nature-based solutions. We have examples of in groups on the North Shore and also in Richmond that are working on shoreline adaptation, nature-based shoreline adaptation actions. So trying to increase the shoreline resiliency to flooding. And we've also got, for example, our City of Vancouver colleagues who are working quite intensely on putting green infrastructure into the community to as we get these big rainfall events to try and address rainfall events and have a little bit less going into our combined sewer outflows out into the ocean. So there's a lot of good examples happening here in BC, and if you'd like more examples, I can crowdsource some of them and bring them to you.
Thanks for that. I just want to point out that Lydia Ma from the National Collaborating Center for Environmental Health has provided a link to some of the resources that Emily was kind of presenting in her presentation. And I just wanted to know, let's see, there's a few others here. Okay. Okay, there's one here. Question relating to the title of this webinar. Any work on looking at those in the vulnerable sector who are unhoused? Typically, when we think of shelters, we consider context of extreme heat and cold. Could or should we extend public health considerations for major flooding events? So I don't know if either Rebecca or Emily, if you feel like you could offer anything on that question.
And Kim, I can clarify if necessary to hone in on this question.
Sure.
Thanks. Yeah, I really appreciate the comprehensive grounds that's been covered, and with Danny showing off the healthyplan.city, we can see the mapping of vulnerable areas or any specific urban centers per se, and then a deeper dive into the population of interest. On that long list, we don't really uncover the aspect of those who are unhoused, which is getting to be more and more. So unfortunately, so in terms of public health responses, we think about getting the communities writ large to prepare to respond, and addressing questions of returning back to homes if they're there.
Mm-hmm.
So there is that population of those who are unhoused and do depend on shelters. It's just that it's a sector that we, the NCCs, not just NCCH, are paying more and more attention to, with shelters as a public health setting.
Mm-hmm.
And yeah, just
okay, and just because we are a little bit short of time, so Emily and Rebecca, do either of you have anything you can offer on this in terms of kind of a public health response to those who are unhoused in a flooding type situation? I know it's a tough question.
Maybe I don't necessarily have an answer, but I know that many health authorities, in terms of their heat response, are working with other organizations who work much closer with those populations. And so sometimes, like at the provincial level, we may not have access to those populations in the way that other organizations do. And those other organizations may have better trust with them, have built those relationships, also have a better understanding of those needs, those unique needs that need to be met. And so that's where that collaboration in terms of developing emergency response measures are going to be really important.
I think this is probably something that we're all struggling with. I know in Hamilton, we do have an extreme heat working group that is actually including a lot of equity deserving populations and organizations that serve those populations. So I see that happening on the extreme heat side. On the flood side, I've not heard of that kind of thing happening, but I think we're also dealing with the bigger issue with unhoused people in terms of just how to actually deal with their needs on a day-to-day basis. But I think it's a really important question, Lydia. I'm just not sure that any of us have the answer at this time. And I'm really sorry, but we're kind of out of time at this point. So I'm going to pass it back to Marie-Claude. But thank you very much for the questions, and Rebecca and Emily, for your excellent presentations. Thanks so much.
I would like to take the opportunity to thank everyone who joined us today's webinar. Your participation is greatly appreciated. This summer, we will be interviewing municipal staff involved in innovative projects that help reduce the risk of extreme heat and flooding, particularly those that also address health risk for the populations at greatest risk. And based on these interviews, we will develop a series of brief case studies highlighting Promises initiative. In the fall and winter, we will host a series of webinars to showcase some of the most impactful examples. So if you know of a project in your community that should be shared with others, please let us know by sending an email to Kim Perota. So that's it for today. We hope to see you at our future events, and have a good day, everyone.